Hello, my name is Jeanette, and I will be doing my abdominal assessment on my patient, John Doe. John, I just need to confirm that I do have your permission to record our assessment and load it to YouTube.
Yes, you do.
Okay, thank you. Now I will start by sanitizing my hands. I have patient's permission. Then we will start by inspecting the abdomen. So I will pull his shirt up, and from looking at the abdomen is the abdominal contour is flat. The skin is appropriate for ethnicity. There is no scarring. There is no striae. There is no erythema. There is no bruising. And looking in his eyes and at his skin, there is no sign of jaundice. Now the first thing I will do is auscultate bowel sounds in all 4 quadrants, starting with the diaphragm. Lower right quadrant. Upper right quadrant. Upper left quadrant. Lower left quadrant. Bowel sounds are normal active in all 4 quadrants. Now I will switch to the bell. And the first thing I will do is auscultate the aorta. There is no bruit in the aorta. Now, renal arteries. There is no bruit in the renal arteries. The iliac arteries. There is no bruit in the iliac arteries and femoral arteries. There is no bruit in the femoral arteries. Next, I will percuss his abdomen in all 4 quadrants. So we'll start with the lower right quadrant. And percussion is general tympany with some dullness. Now I will attempt to percuss the bladder, over the bladder. There is dullness over the bladder. And then we will percuss for the liver. So the dullness starts here. And then So the liver is approximately that size. It's between 6 and 12 centimeters. I will percuss over the spleen. There's general tympany. There is no signs of dullness over the spleen. And now I will start with the light palpation. So tell me if there's any pain when I touch you. There is no pain on light palpation. Okay, now I'm going to do the deep palpation. Again, tell me if there's any pain. There's no pain on deep palpation. Oh. Okay, now I will palpate the liver. So do me a favor, take a deep breath in and exhale. Okay, the liver border is palpated. Okay, we're going to do that again to palpate for the spleen. Take a big breath in and exhale. The spleen is not palpable. And now we're going to do some special tests. We're going to start with the fluid wave test to test for ascites. So I put my hand at midline and just kind of, and there are no waves of fluid felt in my stable hand. So fluid wave test is negative. Okay, now we're going to do the Murphy sign. Where, let's see, press here, take a deep breath in. There was no hesitation, so Murphy sign is negative. I will now test for appendicitis. Oh, Murphy sign is for cholecystitis. Appendicitis. So we will test for appendicitis using rebound tenderness. Tell me if this hurts. And the rebound tenderness is negative. Okay, so we're going to put your shirt down. Can I have you sit up for me? And we'll test for CVA or costovertebral angle tenderness. Maybe turn to the... So tell me if this hurts. Or does this hurt? There's no costovertebral angle tenderness. This concludes my abdominal exam. Thank you.